Communities are inching closer to pre-pandemic life and just in time for a new school year. Today, the CDC announced that it is changing COVID-19 recommendations because of high levels of population immunity as a result of prior infection and vaccination. 2 on Your Side's Liz Lewin joins us now in studio to break down these new changes. Liz?
Well, Mary Alice, these changes may not come as a big surprise to some of you, as a return to normal has been absolutely a long time in the making. I spoke to an expert who says these changes, however, are certainly a step in the right direction, but they are not a reason to throw all caution to the wind.
We're in a different place than we were a year ago. We now have vaccines approved for all of our school-aged children.
On Thursday, the CDC announced updated COVID-19 guidance, putting a bigger emphasis on individual responsibility. The agency no longer recommends quarantining after being exposed. No test to stay in schools unless a student has symptoms, and guidelines for indoor masking have also loosened. The CDC cites the rise in vaccinations and consequently herd immunity as major reasons for these changes, something infectious disease expert Dr. Thomas Russo says doesn't come as a surprise.
This change in recommendations has been anticipated. Both the adult and the pediatric population have a lot more immunity to protect them against COVID. And that's come from the combination of vaccination and also prior infection. There's been estimates that 75% or more of our children have already been infected.
Hamburg Superintendent Mike Cornell agrees, saying he's not shocked by these new recommendations.
Frankly, I think it's exactly what people were expecting. Kids have experienced the least serious COVID-related symptoms, yet they have absolutely suffered the greatest under COVID-related restrictions and requirements. Their lives have been turned upside down, and we just can't have that anymore. So I think what they've done here makes sense.
As for thoughts on recent changes in the test to stay requirements, both Cornell and Russo agree the strategy served a purpose, but at a high cost.
Adding that public health component to it was challenging. It did stretch us organizationally. But we have great people, working in our school districts all across Western New York and here in Hamburg. So we made it work because we had to make it work.
If children have symptoms, parents will keep them home and test them with our home kits. That will serve a similar purpose and will certainly be more cost effective. And that approach could be taken by all schools.
Dr. Russo did make a point to remind me we are not done with COVID. There will likely be more variants and strains, which means some guidance is staying the same, especially for those who experience symptoms. Testing is still widely encouraged by the CDC, and if you're positive, you should stay home for at least 5 days and wear a mask around others for at least 10. Reporting here in studio, Liz Lewin, Channel 2 News.